Hi, I am Dr. Mecca, and I am a Christian counselor, and I a trauma specialist as well. And I work with survivors of sexual assault, domestic violence, and I also work with those who have experienced spiritual abuse. And I pray that this introductory course allows you to feel more prepared to begin your important work in this area. You have read The Body Keeps Score, and this book does an excellent job of discussing what trauma is and its effect on the body. And understanding spiritual abuse speaks to the specific form of abuse, which also leads to trauma. However, to add to what you have read and to reiterate some points already made, I want to talk to you briefly about trauma informed care, what it is, and why it's important when working with individuals experiencing trauma. So let's begin with a simple definition. Trauma informed care is an approach that recognizes the widespread impact of trauma and understand that recovery is possible. It emphasizes creating environments where individuals feel safe, respected, and empowered. In other words, trauma informed care allows you to communicate with those who have experienced trauma in ways that will not compound their trauma or trigger other forms of trauma. As such, there are core principles to keep in mind while interacting with those who have experienced trauma. And I'll list a few of them. Safety. An example of this is creating a physically and emotionally safe environment by ensuring privacy during sessions and clearly explaining confidentiality boundaries to your clients. For example, tell them your stories are safe with me. Your privacy will be respected, and explain to them what that means. Another core value is trustworthiness and transparency. An example of this is clearly outlining what clients can expect during their interactions with you. Respect their decisions. For example, explain their procedures, go over consent forms, and set clear boundaries so clients feel informed and in control of their treatment. Another core principle is peer support. An example of this is facilitating or encouraging participation in support groups where survivors share experiences and healing strategies that have worked for them. And this fosters a sense of community and common understanding. Here in my practice, I do trauma informed groups 3 or 4 times a year as an opportunity for my clients to come together who have experienced similar forms of abuse so they can lean on each other, learn from each other, and grow in the healing process with each other. Another core principle is collaboration and mutuality. An example of this is involving clients actively in their treatment planning. Ask them what they feel ready to discuss and set goals together rather than dictating procedures. You don't want to tell a client when you expect them to get to a certain place. Just allow them to know what opportunities exist if they potentially stay on the path that you may have laid out in regards to your treatment planning, but leave room in there for them to be actively an active participant in that treatment planning because they need to be in control of it, in other words. And this leads me to the next core principle, which is empowerment, voice, and choice. This allows clients to choose their preferred coping strategies or healing activities, such as mindfulness, art therapy, or spiritual practices. And this allows your client to be in control of their healing. It gives them a voice in the process and it enforces the notion that they have a choice in what happens next. Because as many tools as you may have to help your clients on their journey to healing, everything is not going to work for everyone. So it's important to allow your clients to participate in the process and as much as possible control the process so that they know that they are empowered to do what it is they need to do. Their voice is heard and respected, and ultimately the choice is theirs. And then the last core principle is cultural, historical, and gender sensitivity. This is very important. An example of this is recognizing and respecting cultural and spiritual beliefs and avoiding assumptions. For example, we being aware of cultural norms related to gender roles and adjusting accordingly is very important. We cannot assume, based on what we think or what we have experienced, that we know. So it's important to ask questions for clarification if we are unaware. And when these principles are integrated in this way and is incorporated in your care with those who have been traumatized, we can reduce the risk of re-traumatization, and instead we can contribute to the holistic healing that I spoke about. So why is this important to understanding and subsequently applying these principles during our interactions with individuals experiencing trauma? Well, as you may know in your work, trauma is incredibly common. Many people have experienced some form of trauma in their lives. As you know, trauma influences not just emotional well-being, but also behavior, beliefs, and our physical health. And as clinicians, social workers, advocates, or anyone who interact with and care for people, we will be more likely than not to encounter someone who has experienced trauma. So by adopting a trauma-informed approach, we acknowledge this and we respond in ways that support and sustain healing. A trauma-informed approach provides a holistic viewpoint as it addresses emotional, physical, and sometimes spiritual needs of those who need our help. So speaking of which, you read all about spiritual abuse and trauma and how these things work together. So it is important that we are sensitive to the feelings that such abuse has caused. Survivors might wrestle with feelings of confusion, guilt, and fear of condemnation, as you have read, because it often involves betrayal by trusted spiritual figures or systems, and healing can be extremely complex. So, when helping survivors of spiritual abuse, it is important that we are not trying to convert them to our beliefs or challenge their beliefs. It's about supporting them and validating and providing empathy for their experiences. See, it's our job to recognize the betrayal and the deep wounds that spiritual abuse have inflicted. And we need to create these safe spaces that I spoke about where they can share their stories without fear or judgment. And it's important for us to build trust because survivors of any abuse, especially spiritual and sexual abuse that you would hear about in another course, may have difficulty trusting others after their experiences. So as practitioners or whatever field that you're in, when you're working with survivors, we should support them in reconnecting with their spirituality or their faith, but it must be done on their terms if they choose, because then that might not be something they want to do. So it's important to help them heal from the guilt, the shame, and the spiritual disconnecting that they may have experienced, but we have to do so by avoiding re-traumatization. We want to be cautious with our language and our attitudes to help prevent recreating abusive dynamics. And I know this can be challenging when we too have experienced some of the traumas that we are trying to help people with. So it's important to even take additional training on the language to use and not to use when working with survivors in different areas of abuse. But the best thing that we can do at this point is first apply active listening, which allows us to truly hear them and validate their experiences. We want to empower them to make their own choices. We must respect their autonomy and apply the core principles discussed initially. So, in summary, trauma informed care isn't just a method, it's an ethical and compassionate way to support those who have experienced trauma. And for survivors, especially survivors of spiritual abuse, trauma-informed care provides a pathway to healing. It restores trust and it reconnects them with their sense of spiritual well-being. So by creating a supportive and understanding environment, we can help survivors feel seen We can help them feel heard, and most importantly, we can make them feel empowered on their healing journey. So thank you so much for listening. And I hope that this provided clarity on the importance of trauma-informed care and how vital it is for supporting survivors of spiritual abuse. May God bless you and may his light shine bright as you lead those experience trauma out of the darkness that they feel. Take care.